We now go above and beyond the headlines. Dr. Lulu Bravo, a member of the Doctors for Truth and Public Welfare, she joins us via Skype. Good evening, Dr. Bravo. Welcome to Newsnight.
Hi. Hello.
Hello, ma'am.
Thank you very much for having me.
Yes, thank you very much for joining us. Ma'am, can we begin with this? The WHO is saying that Dengvaxia can be on the list of, or is on the list of medicines that people should have access to at all times. Can you give us the entire picture? No? What are we looking at?
Well, that was released early this year by WHO, which actually gives us the fact that the WHO believes that this is a medicine or a vaccine that can be used by those who need it most. And you know, who need it most are the countries which actually has a very high incidence of dengue. Pinakamataas ang ating dengue incidence dito sa banda ng Asia na ito. We have reached more than 200,000 in previous years. And ang tingin ko ngayong year na to, nangangalhati pa lang halos yung taon natin, we are going to reach maybe more than 250,000 cases for this year alone. And did you know that dengue incidence is actually increasing not just in the Philippines but worldwide? Sa buong mundo, tumataas talaga ang incidence ng dengue dahil sa population overgrowth, dahil sa urbanization at dahil sa climate change.
And this is also unfortunate, Dr. Bravo, because well, the Philippines is the only country, is that correct, to have banned Dengvaxia?
Yes. The Philippines is the first country to introduce Dengvaxia in 2016, followed by Brazil. The Philippines introduced it April 2016. Brazil introduced it as a mass immunization or pangmaramihang pagbabakuna August 2016. And mind you, Brazil is continuing now, and we just got the news last week when we were in a dengue summit that Brazil is continuing because they have found it quite effective.
Okay. Ma'am, let's just clarify one very basic thing. No? Dengvaxia is going to work for those who have had dengue and not for those who have not had dengue. There's a lot of speculation going around. So what is the truth about that?
The truth is the clinical trials that have been done in many, many years before. It started as early as 2010. We saw that it is most beneficial in those who are seropositive or yung nagkaroon na ng dengue. Pero hindi ibig sabihin na yon na yung mga wala pang dengue, hindi rin mabebenefisyuhan. Ang sinasabi ng report is, ang Dengvaxia mas maganda sa nagkaroon na. Pero dun sa mga hindi pa nagkaroon ng dengue, meron pa rin benepisyo. Yun nga lang, merong konting risk doon sa 2 out of 4,000. Pero yung iba, kung titingnan mo, 2 out of 4,000 lang naman yung mag-risk doon sa hindi pa nagka-dengue. Doon sa 3,998, mabebenefisyuhan din. Maaring mabenefisyuhan.
Dr. Bravo, in a way, this has become a very unfortunate situation because medyo, like, you know, some observers say, napasukan ng politika, to be very frank about it. And what has happened is that several government officials have gone after several former officials, fighting cases against them. It created, in a way, you know, this is a medical issue. It created, in a way, para bang nagkaroon ng takot tuloy yung mga tao sa Dengvaxia. At hindi lang sa Dengvaxia, sa dengue vaccine, pero doon din sa iba pang mga bakuna. Hindi po ba? So there was a time na there was a lot of concern sa inyo, in the ranks of doctors, na maraming hindi nagpapabakuna ng mga anak nila, hindi lang against Dengvaxia, hindi lang against dengue, but yung mga vaccines, immunization, na kailangan ng mga bata. No? So parang ganun po yung naging epekto, hindi po ba?
That's right, Pia. actually as early as January of 2018, when the Dengvaxia issue came out in Congress, in Senate, when the hearing started, there was already beginning hysteria, panic. People were no longer getting their vaccine. Mothers will shy away. You know, yung mga barangay health workers, and I've been working with barangay health workers, they were crying because they were being stoned, they were being ostracized, they were being thrown out of the community at sinasabi, child killers daw sila, ganyan-ganyan, ayaw na nilang magpabakuna. And that time, we already cautioned our public health people or our lawmakers, policymakers, even media, even everyone. It came out on January 31, 2018. The Doctors for Truth actually warned that there should be some caution. There should be some stop to this kind of hysteria and fear-mongering among our people, because there is still no evidence. The investigation could be ongoing. We do not have clear evidence that this is going to be wrong. In fact, everywhere in the world, it is still being used.
Okay. Like we were saying a while ago, ma'am, syempre naapektuhan din yung ibang mga vaccines. For a while also, wasn't it measles? Yung nagkaroon, ang daming kaso ng measles. Kasi nga, yung isang vaccine na ayaw ipabigay ng ibang mga magulang sa mga anak nila ay yung para sa measles. But anyway, ma'am, just my one last question na lang po. Kanina, sabi ng isang Health Assistant Secretary na pag-aaralan pa raw nila ng mga eksperto itong Dengvaxia, dengue vaccine. Pero hindi po ba yung WHO na siyang nagsabi na dapat isama na sa listahan ng mga medicines o gamot na kailangan mga tao? Hindi ba yung WHO, yun na po yung health expert? So kailangan pa bang pag-aralan ng ating health department, or pwede na bang sundan yung sinabi ng WHO?
Actually, Pia, correct ka dyan. It gives you a feeling of why are you distrusting the World Health Organization, which is actually a worldwide experts have already convened, have already looked at this, hindi lang local experts natin. In fact, it's composed of so many experts from around the world. America, Europe, sa Asia, meron din sa Latin America. All the experts have already convened and shown that there is a benefit, so much benefit can be given to that clinical trials that have been done.
Yes,
so, bakit nga, di ba? Ano pa ang kanilang gustong makita? Ang gusto nila sabihin ng mga unqualified na yung baksinang yan, hindi maganda. Pero sino ang papakinggan? Yun na nga ang aking,
Alright.
kung sabay, nakakasama ng loob, no? Sino ba talaga ang pakikinggan natin? Kung ikaw ba may sakit sa puso, pupunta ka sa attorney para magpagamot?
Siyempre hindi.
Kung ikaw naman nakamatay at may krimen ka, pupunta ka sa doktor para ayusin yung
Siyempre
iyong
hindi,
kaso.
pupunta kayo sa abogado. Anyway, ma'am, Dr. Lulu Bravo, thank you very much, ma'am, for your time. I wish we had more time, but we don't have that anymore. Maraming salamat po.
Well, thank you, Pia.